up for the COVID-19 update.
Hello, Mayor DC. Good afternoon. I have a presentation for you today. Pull that up. Here we go. So this afternoon's update is going to include a dashboard review from Coconino County Health and Human Services, Northern Arizona Healthcare, Navajo Nation, as well as the Hopi Tribe. And then Rose will also share an Indigenous Nations update. There was quite a few specifically for the Navajo Nation. So getting right into the data, we did see for week ending January 8th, a large uptick. They reported 3,085 new cases for Coconino County, which was an increase from the 1,451 the week before. Flagstaff has continued to see an increase in the number of new COVID cases over the last 4 weeks, beginning December 11th, 2021. Our number of hospitalizations has increased this week to 37. We also saw last week the number from 19 to 21, and then an increase for weeks December 18th from 25 to 27, and the week of December 25th from 25 to 28. So hospitalizations seem to have a little bit of a lag, so I'll continue to keep you updated as we see those numbers fluctuate. Moving on to deaths, the good news here is that we're starting to see a downward trend in the number of COVID-19 related deaths. We had one reported for week ending January 8th. Previously on January 1st, they had reported 3, which has increased to 4 now. We did have one more death reported for the week of December 11th, taking it from 7 to 8. And again, the week of December 25th, taking that number from 6 to 7. So that's why you see that previous straight line of 6 now have some up and downward trends. When we look at our community transmission, it continues to be at high. We had 2,180.4 incidents per 100,000 for the total new cases in the last 7 days. Our percent positivity has increased to 29.9%, and our COVID-like illness has increased to 19%. All 3 of those numbers have increased when you compare them to the data from January 1st. The good news is our vaccinations continue to increase each week, the number of Coconino County residents who are fully vaccinated. This most recent number, 70.3%, is from the county's website as of this morning, and that compares to the 69.2% reported during our last dashboard. Looking at our COVID-19 variants, we did have samples from December as well as January. When you look at December, there still is some Delta variant as well as the beginning of Omicron variant showing up in those samples. Our Delta has increased by 130 since our last report on January 1st. And the Omicron has increased by 156 new samples, again, since our last report week ending January 1st. When we look at our breakthrough cases, those are increasing. This most recent report showed 15.8% compared to 13.1%. Again, Coconino County Health and Human Services reports this number will continue to grow the further folks get away from the date in which they were fully vaccinated. This also aligns with what we're seeing on the CDC in their encouragement to get boosters, is that if you have been 6 months past your fully vaccinated date, they're putting you in with the unvaccinated individuals when you're looking at exposure as well as the potential for COVID. So I would encourage, if folks haven't taken a look at that, please visit the CDC website for those updates. That was updated as of December 27th, and we previously had reported that out. When we look at our hospital capacity, we've seen just a slight increase in the number of positive patients since our last report, from 53 to 60, and our number of individuals who are pending COVID patients increased from 1 to 3. Our number of beds available in the hospital has decreased by 6. Our last report had 38 beds. This one shows 32. And our critical care has 1 additional bed available for 2 this week compared to 1 previously. And these numbers are valid as of this morning. Turn it over to Rose Tohi so she can share about the Navajo Nation.
Good afternoon, Mayor and Council and staff, leadership. I'm going to go ahead and turn off my camera after I say hi. So as far as Navajo Nation is concerned, since I was on vacation, and so that's why the 45 days. So you can see that within the 45 days, there was, testing, of course, is always ongoing, now at 43,000 plus from our last report. And then negative cases are also climbing, always increasing. The confirmed positive cases are at 4,813, and that our last count, the last report was at 1,824. So that sort of jumped pretty high within the last 44 days. And then the recoveries are at 2,797, and that stayed about the same from the last time. And then deaths have also increased to 57. And that is up from 35. The last report was at 35, and that's now at 57. Okay, next, Shannon. So as you recall, I used to have a chart here for Hopi Tribe. However, they have not reported as they normally had been doing in the last few months or since COVID started. So now what they have is a message from the health director, and also these numbers, which are what I'm reporting. And they have the 279 active cases within the 14 days, last 14 days, and 146 for the last 7 days, according to the time that I reported on last week. And their reservation vaccinated is, of course, at almost 82%, and total eligible vaccinated is at 90, almost at 91%. So that's really good news. Next. And then for the Indigenous Nation updates, the Navajo Nation COVID cases that are attributed to the variant of concern are there 1,250 for Delta variant, 81 for Epsilon, and 19 for the Omicron. So on Navajo Nation, the Omicron was first detected in about mid-December, according to their reports. And then also the 72.5 of the eligible individuals are vaccinated. And that, according to their definition at the time, was fully vaccinated, which also in the last few days have noted that they were also going to change that definition. Eligible population is defined as the Navajo Nation community residents and within service delivery areas of the Indian Health Services. The public health emergency order, which was declared for red status for schools, and also the businesses, remains at orange status. So that is, as far as the school is concerned, that emergency order is effective as of January 12th. And that is defined as high transmission of COVID-19, and the schools on the reservation must implement all required core and conditional prevention strategies consistent with the Safe Schools framework. Some of these strategies will include implementation of more aggressive physical distancing, even also hybrid, in-person, and virtual or virtual learning will be offered to their maximum extent possible. Also, their limited gathering is 15 or fewer persons for non-classroom instructions. Limited sport events attendance is at 25% maximum occupancy for indoor and outdoor seating areas. And then for the business, the orange status remains at open to 50% maximum occupancy, and gyms and recreation facilities are not allowed under the orange status. For the Navajo Nation employee vaccine and testing requirements, back in 2020 or 21, when later 21, maybe a couple months ago, Navajo Nation had declared a state of emergency mandating COVID-19 vaccinations for all Navajo Nation employees. So this is an update and revision to that executive order, which includes the following: that all employees, regular, part-time, and temporary, must provide proof of COVID-19 vaccination booster status by January 24th of this year. It is reaffirmed also that employees not vaccinated or boosted shall submit a negative test, a negative test result to their immediate supervisor at least once every 14 days. And it's also reaffirmed that employees who fail to provide these negative COVID tests will result in subject to disciplinary action consistent with their Employment Act and Personnel Policy Manual. And then as far as the health advisory for the 42 communities, this hand advisory was issued for uncontrolled spread of COVID-19 advisory for 42 communities, and this is down by 23 communities since my last report. And then schools serving these communities are to implement their layers of mitigation to meet the high level of these community transmissions. For the Hopi tribe, excuse me, continuing with the third part of phase reopening doesn't have a change. So they are still under the issued executive order from May of 2021. And this is where it's recommended that they continue face masking inside all public buildings, common areas, and outside location where physical distancing isn't possible. And then the EO also states that employers must resume unrestricted staffing at work sites, and then also businesses must demonstrate their workplace settings to be built in so that there's social distancing and protection of staff. As far as the Hopi Relief Fund is concerned, as the end of December 2021, the Hopi Foundation was in charge of the Hopi Emergency Relief Fund. So this will end as of the end of December, and those direct service operations will be transferring to the Hopi Relief, which is a different organization. And then the Hopi Foundation will revert back to their other activities in providing services that they had with Hopi programs and other programming and the funding sources that they will shift their attentions to. But the Hopi Relief will have all the information regarding COVID isolation, the PPE kits, and air purifiers for the Hopi programs and businesses as needed. And so people will need to reach out to the Hopi Relief Program. And that's all I have for our Indigenous Nations report. Thank you.
Thank you, Rose, for your presentation. Mayor DC, Rose and I are available in case council has any questions, and certainly to assist in any discussion.
Thank you, Ms. Anderson and Ms. Tohi. Vice Mayor has a question.
Thank you, Mayor. Ms. Anderson, I'm wondering whether you're able to speak to additional steps that the county might be taking in terms of public health, and whether we know their outlook on these rising cases and how soon they'll have tests available. Any information from the county health department?
Thanks, Vice Mayor Daggett. I don't have any more recent updates than what Kim provided to us. I guess it was about 2 weeks ago when she joined the special council meeting on COVID. But I certainly can follow up and share any new updates with all of council.
Yes, please do. I'm very interested.
Certainly.
Thank you, Vice Mayor. Councilmember Shimoni.
Thank you, Mayor, and thank you, Deputy City Manager Anderson and Rose, for the updates and your work here. Quick question for you, Shannon. The data shows that the dominant variant is Delta at this point, but I'm assuming the data is simply lagging because my guess is that the current surge that we're experiencing in the community is dominated by Omicron. Can you speak to your experience in looking at the data regarding the variant that's being tracked? Is it on like a 2-week lag, would you say? Do you have any thoughts on that you can share?
Councilmember Shimoni, I don't know how long the lag is, but I can tell you this most recent report for the week ending January 8th showed December was majority Delta, but that's when we started to see Omicron being shown in our samples, and 100% of the January samples are all Omicron. So although we're seeing an increase in our numbers on Delta, that would have been from our December samples, not January.
Okay, that's helpful. Very good, thank you.
You're welcome.
Well, Mayor, I do have some comments when it comes to the J. Lively Center, but I'm not sure if now's the right time to dive into that.
We do have one public participant, so we will take that before we add that. So I had a couple comments / questions. I noticed with our extremely high positivity rate of 29 some odd percent, that Navajo Nation was actually, by those numbers, at about 11 to 12%. And I'm just wondering if there's any, and I know it might be supposition, but any reasoning why their positivity rate so close to us is so much lower? Would that be because of higher vaccination rates? Are they having easier access to testing, so it's just a matter of the N is higher for the number of people being tested per capita? Or is there any insight that might be drawn from those differential numbers between Coconino County and us versus our tribal neighbors?
Mayor DC, I don't have an answer as to why Navajo Nation is experiencing lower positivity rates than Flagstaff. But again, when I follow up with Ms. Musselman, I certainly can ask if they have any insight. I think what we heard from Navajo Nation is they still have quite a few things closed down in their orange status. If I heard Rose correctly, gyms, recreation, those things are completely closed in the orange status. And again, their red status takes schooling back to hybrid. And so it could be some of those practices, but I wouldn't want to make any assumptions. So I'd certainly like to ask those that work in this field for any input that they might have.
Thank you. I'd appreciate it. I just think that differential in numbers is noteworthy. The other comment I had was if you might be able to circle back to the age groups on hospitalization, I'd appreciate that, just to make a quick comment on it. Excellent. There we go. I just want to notify as we look at this chart, look at the age group of under 20 that has now seen a rise in hospitalizations that we hadn't seen before. That would be the dark green at the bottom of these charts. So please make sure, everyone, that we all realize that if you are young doesn't mean that you are immune to this virus, that it doesn't mean that it's just going to be a little cough and a cold. There are many young individuals who are immunocompromised. There are many young individuals that are at risk. So please take precautions and realize that a lot of young children are at risk here in our community moving forward. That's the only comment I had to make on that. And aside from that, if we don't have any other comments or questions from council, I'm happy to take the public participation before we go back to Councilmember Shimoni regarding the ice rink.
Terrific. Thank you, Mayor and Council. Travis Jorleman, if you could please go ahead.
Yes, thank you. Can you guys hear me?
We can hear you fine.
Awesome. My name is Travis Jorleman. I'm the president for the Flagstaff Youth Hockey Association, and thank you, Mr. Mayor and Council, for your time today. I just wanted to kind of ask a couple things and kind of just reiterate what our program does, right? So we provide youth hockey, whether it be in-house club programs or travel programs, which is the more competitive side. We do have 110 club kids within our association, which is great after COVID and the decline that we saw. We have 60 travel kids within our programs, and we do have lower travel programs, but we're hoping to build that back up. My ask is that the council consider the following revisions to their decisions at the last week's meeting. I'm asking that the council, and I did send a public comment and a couple emails, and I appreciate the council members for getting back and working with me. But my request is that council consider the 100 capacity limit to be restricted for the private user groups to the spectator only area. The reason for that is rink management before has kind of communicated to us that there's essentially 4 areas within the rink, which is the lobby, the bleachers, and both of those can kind of be considered spectators. We have on ice and then the back locker rooms, and essentially those are all defined spaces that can be managed. So 100 spectators, if we take away the athletes and the coaches for our programs, it just kind of limits the spectators in the building, but allows us to have not impact our programs and the travel games that we're having in Flagstaff. I asked that the city consider reversing the decision for masks during practice. There's not kids on the bench. All the kids during practice are on the ice. The rink is 17,000 square feet, so there's more than enough room for these kids to be spaced out during practices. There's no contact. This isn't professional hockey where they're constantly hitting and having that full contact. We understand the mask mandate during games, and we're looking for middle ground. We can't have everything that we want, right? So we want to respect that decision and use the masks or the city approved alternatives to masks for home games, and we appreciate that. I just wanted to reemphasize too that there's only really 2 main weekends left for travel games for the season. We're trying to just finish out the season strong, but we got games on the 29th of January and the 5th of February where we have teams coming in, and we want to be able to host those teams and have the parents be able to watch their kids playing hockey. Thank you for you guys' time, and let me know if you have any questions.
Yeah, thank you very much. I see Councilmember Shimoni does have a question for you.
Thank you, Mayor, and Travis, thank you for your comments and for your emails and leadership in our community with the youth hockey community. I do have a question for you. So you and I spoke on the phone, and you really helped me better understand the landscape of Jay Lively and the concerns that you have. We talked about 100 spectators in the building and that being maybe one of the limitations that we put in place. Talk to me about the pros and cons of just keeping it to 150 in the building in total. What would this do to the different teams or groups?
So if we were to do 150 versus 100 spectators, is that kind of the question?
Yes, 150 total in the building versus 100 spectators.
Right. So what this means for us is when we have, there's a couple different aspects here. We have travel hockey, right? So when we have games in Flagstaff, we're going to have, we have defined locker rooms in the back. So we're going to have two teams getting ready. They get on the ice with our ice slots that we're given with the city. While they're playing, we're going to have two other teams kind of coming into the building, getting ready. They drop off their bags. They do warm-ups. They're in their locker rooms getting ready. So the team that leaves the ice, the two teams that leave the ice go to their locker rooms, and then the next two teams comes out. So there's never essentially overlap when we're talking about the back locker room area and stuff. Each team, if we were to talk about a set of games, we're going to have 40 people within the players, the coaches, and the on-ice officials. So as we have two teams on the ice, that's 40. We're going to have two teams getting ready, which is 40. So that's 80 people total. That doesn't leave us a lot of spectators if we were to do 100 total, not the spectator request that I'm asking. If we were to change that to 50, that would allow us to have 150, excuse me. That would allow us to have, the players and coaches in addition to the families that are driving up here and the local families that want to watch their kids play. The benefit for just 100 spectators is all of the areas in the back hallway, the locker rooms, they're all defined spaces. And so really what we're trying to do is allow the parents, the spectators, 100 spectators to spread out and manage it that way versus trying to set capacity, which also would be beneficial to the rink staff. As you check into the building, you say you're a player or coach, where they're trying to manage just 100 spectators. It's a lot of work for the rink officials to keep track of all the different areas. And if they have to just keep track of spectators, it's going to help them be efficient in their job as well.
So what I hear the difference being is if we limited it to 150 in the building, 40 on the ice, 40 in the back, that's 80. That means 70 spectators would be allowed versus 100. Is my math correct, Travis?
Yes. Yep.
Okay. Thank you, and thank you, Mayor.
Thank you, Councilmember Shimoni. Is there any other questions for Travis before we open up for council discussion? I'm not seeing any in the chat box. Thank you, Travis, for helping us better understand the situation on the ground in Jay Lively.
Yes,
with that, yeah, thank you. My apologies. So with that, I'm happy to turn it back into council if we want any discussion or changes or any further commentary before we move on with the agenda. And I do see Councilmember Shimoni turned on his video, so I'm assuming you want to jump in here.
Yes, I do. And Mayor, let me know if my video starts getting choppy, and I'll just turn it off, but I'm going to try to leave it on. Director Sayers should be on the call, and if she is, I do have a couple questions for you, Director Sayers. Rebecca, can you speak to the pros and cons in your mind between, if I, as a council member, should advocate for 150 in total in the building versus asking Jay Lively staff and leadership to simply regulate the number of spectators to 100?
You bet. So it is difficult for staff to manage the different parts of the building. So just keep in mind that we're dealing with our own staff being in and out with sicknesses. And so far we're doing okay. My recommendation last week was to limit capacity to 100. I'll just remind the council that when we were in Tier 2, not phase 2 of the reentry plan, but Tier 2 of the Jay Lively site-specific plan, which I understand can be a little confusing. We had a limited capacity of 50 total, and we felt like 100 would still allow for spectators, so especially parents and families, to see their children play. I understand the commenters' notes about the number of spectators, and 100 spectators specifically would be better to allow more people. I think it's easy. I'll just be honest. I think it's easier for staff to count the number of people coming in the door. And because we have an entry and we have an exit, and as long as people are following those rules, then we know how many are in the building total, and we have an idea of how many can spread out. So we'll go with council's direction. We'll manage what you prefer, but I do think it's easier to have a facility capacity, whatever that number may be. Then I'd also like to just let the council know that the other reason we were limiting capacity total was so that we have enough staff to help manage the compliance with the mask mandate. So all of those spectators need to be masked, and they need to be masked the whole time. The more that we have in there, the more staff needs to spend time reminding people to keep their masks on. And that is an issue.
Rebecca, thank you for that. And so considering what, the commenter spoke to, 40 on the ice, 40 in the back, that would leave 20 spectators in total if we're going with 100 total number. He was basically advocating that I think we raise that total number to 180, if my math is correct. So that, whether it's 100 spectators, it's basically 100 spectators plus the two teams, 40 on the ice, 40 in the back, or the two groups of players. Do you think, well, I guess my question is, what are your thoughts in terms of the max capacity that our staff can handle? Is it 100? Is it 150? Is it 180? What are your thoughts?
I really would not recommend much more than 150. In terms of having 40 on the ice, say having a game, and then 40 players in the locker rooms, again, that's just more spaces for staff to have to try to manage. What we did before, and we have been trying to do since last week, is work with our user groups on their schedules of games to allow for more time in between games so that the previous teams could exit and then have time for the new teams to come in. That helps reduce that capacity of 40 on ice and 40 in the locker rooms. We can't always accomplish that with the user group schedules. And I understand the commenter probably has some ideas about that. But that is how we were managing it previously, was we worked with them to schedule out those times so that an entire group could leave the facility, and we would actually ask the next group to not come in until that group had exited. And then the next group can come in. And that's a way to limit that capacity. 180 just starts to sound like a lot of people. It just does.
I can appreciate that. And then really quickly, a couple more questions. So what are your thoughts about practices not requiring mask wearing on the ice?
So council may recall from our presentation last week, that's what we have been doing for months. And that was our recommendation last week. So at council, if council would like to go back to that, that's okay. We also had made allowances for referees during games to not have to wear a mask if they could be distanced. So what was happening was most of the game, the referee is distanced. But when they need to do a face-off or something, the referee would put the mask over their face and then pull it back down. That allows them to do what they need to do, blow their whistle. I mean, there are other options for that too, but that's previously what we had been doing. And so we're okay with going back to that if council so desires.
And then very, very last question. Are you still okay with like games requiring masks being worn Do you have any comments on that?
Absolutely. There's just in hockey games, you just never know when you're going to get within. You just can't distance, and I don't think anyone would argue that you could or should. So previously, what we'd been doing was masks or the bubbles or the face shields were required during all games, and this goes for all of our leagues, not just youth, but also our adult leagues that we operate as well.
Very good. Thank you so much, Director Sayers. Mayor and Council, after talking to some folks, I do feel like we should really consider adjusting what we had decided to move forward with last week, and I personally would feel comfortable with 150 in total in the building. I also feel comfortable with practices not requiring masks because they are able to social distance for the most part while being on the ice, and it being a very large open space. And then for games requiring masks, and then as Director Sayers said, not requiring referees to mask. I just think that makes sense, and I know that's a lot of detail, but I think that is that middle ground that we want, and that also works for the hockey community. Curious to hear what your thoughts are, Mayor and Council, and I appreciate it. Thank you.
Thank you, Councilmember Shimoni. Councilmember Aslan?
Yeah, I would like to echo Councilmember Shimoni's sentiments exactly. That's all. Thank you.
Thank you. Councilmember Salas.
Thank you, Mr. Mayor. Yeah, I also support Councilmember Shimoni's and Councilmember Aslan's recommendation. Thank you.
Thank you, Councilmember Salas. Councilmember McCarthy.
I'll be number 4 to jump on to what Mr. Shimoni just suggested.
All right. With that, there is a majority to move forward with this. Any other further suggestions, questions, any items for discussion from council aside from Jay Lively? Councilmember McCarthy?
I just spoke. I said what I was going to say.
Okay, sorry, I saw the hand up there and I didn't.
Yeah, I'm sorry. I'm trying to get it down.
No problem at all. Okay, well, with that, we are ready to move on with the agenda. Thank you, Deputy City Manager, as well as Coordinator Tohi for your presentation as always. And we are down to agenda